Okay, so let us start. Once again, thank you very much to all of you for joining us today, and especially to Amanda for organizing this. And I know that quite a number of you are from different parts of the world, so welcome. Today we'll be talking about scoliosis, especially a lot of myth that's out there. Every time we see people or different patients, or even when we have doctors, they contact us, they always ask us many different questions such as what causes scoliosis, or how do we address it, or we have a lot of questions even from Indonesia or Malaysia where doctors are constantly asking, is this the right form of treatment? Is it up to date? And in Philippines, one thing I've noticed when I've been traveling and teaching is that you're in very good hands. The doctors in Philippines are very, very dedicated. And I'm not just saying that because I'm in the seminar. And it is actually true. I've been to the seminars. I've seen some how the doctors interact. So if you do have scoliosis, contact. You can contact Scolio Care. We can always arrange to have you meet one of the doctors near you. Now, one of the things is that if you have any questions, you can always message, email Amanda, or you can always contact me directly as well. I do reply every single message that I receive. So yeah, don't be shy. Yeah. So today we talk about scoliosis, and I'm sure you're here today either because you have scoliosis or you know someone who has it, or in many cases you don't know what to do or how do you detect if a person has scoliosis. So traditionally, the way we look at scoliosis is that we will look at someone, look at their posture from the back, from the side. And if any of you remember this, when you're in school, you have either a doctor or nurse present to your classes, and then they ask you to bend forward, and then they take a little measuring tool, and then they will measure your back. Now, when you look at the spine, one of the first things you look at is that this is a lovely picture. Once again, thank you to the lovely lady who allowed us to use this picture. When someone is bending forward, I know that some of you are probably wondering, what are the doctors looking at? So, whenever you have your spine assessed, you'll be asked to bend forward, drop your head down, and put both hands between your knees. And we are essentially looking for things such as this. Do you have any humping of the ribs? So is any part of your body more prominent, for example, in the upper body? Or are you having any kind of prominence in the lower back area? And the other thing is when you're bending forward, your spine is supposed to bend straight downwards. Or are you curving off to the side? And is it continuous, or do you start to see the spine curving off to the other side? So this would give us an idea of what type of curve we're looking at, but it really doesn't give us enough information. So another thing we do is we look at your waistline. Is it symmetrical? So you can see on the side over here, the left side, the purple, you can see that that's quite a big concavity there. And then on this side, it's almost flat. So the other thing we look at is your posture. So you look at someone's posture, you look at them from the front and the back. So if I'm looking at someone from the front, one of the first things we look at is look at the eyes. Are they on the same level? Then we look at the neck, we look at and then we look at the shoulders. So with the shoulder, you're trying to see, are they both symmetrical? Are they both aligned equally? Or is it one side slanting? And as you can see here, for this lovely lady, her right shoulder seems to be a little bit longer, and the left side seems to be a bit more narrow. Then the other thing we look at is that if we're looking at her posture, we also look at the collarbone, so what we call the clavicle. So you're looking at the collarbone to see whether or not they're both symmetrical as well, or are they tilted at a different angle. Next, we look at the waistline. So over here, you can see for this lovely lady, the right side is curved. And then if you compare to the other side, they're not symmetrical at all. So in most cases, it should look more like an hourglass. Okay, so otherwise, if you're a man, then sometimes if you don't have love handles, it's supposed to look more like a V shape, okay, or more like a ladder. Then you look at the pelvis, and with the pelvis, you're trying to see, are they both aligned properly, or is one side tilted more than the other? Now, Then you look at the arms. How are the arms hanging? So if you're at home and you have children, you can actually assess them this way. So have a look at your child when they're standing and look at them either from the front or the back. And this is a very nice way of assessing your child, okay, or yourself. And you can see both of the arms are hanging and dangling in a very unusual fashion. Now, from the back view, oh, sorry, continuing this, if you look at the shoulder, you notice that the shoulder and the hips are not in the same alignment. So the shoulder is slanting and shifted more towards the right side. Okay, so you compare that to the back. So if I'm looking at someone from the back over here, what I'm looking at is have a look at the ears. Are the ears on the same level or is it slightly tilted? Look at the contour of the neck and have a look at the shoulders. Is one shoulder horizontal and the other tilted? Are they both sitting in the same position? Then the other thing you look at is to have a look at the shoulder blade. Now, when you're looking at someone from the back, the shoulder blade should either be pointing vertically downwards or slightly like V shape. As you can see from this young girl, if you can see my cursor key, this is actually tilted quite evidently over here. So you can see the difference between the two shoulder blades, and one of them is bulging out. Then the next thing we look at is, once again, have a look at the waistline from the left compared to the right side. And we look at the pelvis. One side is tilted more, the other side looks almost vertical. And then you look at the shoulder compared to the hips. So you can see in this lovely lady here, her right shoulder is far more shifted, or what we call translated to the right compared to her hips. So usually when you're looking at a spine, you always see this expression that your posture is the window to your spine. Have you ever heard that expression? Now, unfortunately, it is not true, because we do see a lot of cases where you may have someone present into your office and they have an absolute beautiful posture. They're standing perfectly straight and you cannot see anything. There's no tilt, there's no bulge. For example, we have patients who come in who are ballerinas or they're dancers and they're very in tune with their body. And when you take an x-ray, the spine is quite, you can see a really huge curve. Then we see patients who come in hunching, completely leaning to one side. Then they take an x-ray and the spine looks perfectly normal. So the only real way that you can actually tell if someone has scoliosis is don't just rely on your posture, but you need to take an x-ray. And this is extremely important because when you take an x-ray, you will see images, something like this. And I know that most of you, when you go for an x-ray, try and get an x-ray that is taken in one shot, and preferably from the bottom of the neck or mid-neck all the way down to the pelvis. So you can actually see the whole spine as a unit rather than having the x-ray taken as multiple sections. Because when you do that, it is very likely that you'll be moving, shifting your body, and the image, the scaling may be different. Now, when you look at an x-ray, one of the things we look for is that, well, what type of curve do you have? Do you have just one curve? Or in some x-rays, you may see, look, there's another curve. So one thing you'll notice over here is that you can actually have just one curve, and it's mostly in the upper body, okay, or in the lower back. Or in some cases, you can see two curves, one in the top, one in the bottom. Then, in some cases, you may even see three curves. Now, I've been doing this for, this year would be my 25th year in practice, and I've only ever seen 5 curves only 3 times in my life. Okay, so yes, it does, you do get 3 curves, 4 curves, and 5 curves very rarely. But most commonly, we always see double curves or triple curves and more the singles. Now, you can also have the classic huge C curve. Now, at the end of the day, a lot of people don't take into account that if you look at your posture from the side view, hunching is also scoliosis. So a lot of times we always look at and think of scoliosis as leaning more to the left or to the right. But we always forget that hunching, or what we call hyperkyphosis, is actually a scoliosis in itself. So there's a lot of theories behind scoliosis and a lot of models. And this is actually where the myth comes in. And you have everybody that comes from different schools of thought. And a lot of people will say that, look, the main reason why you have scoliosis is that it has to do with muscle imbalance. So people will always say that your spine is pretty much like a tree. and you have ropes on left side, right side, and it's all about tug of war. So if the muscles on your left side are pulling more than the right side, then your spine leans more to the right. If the left side happens to be normal, but your right side is weaker, then the left side is relatively stronger than your right, so you'll be pulled more to the left. So there's a lot of exercises, a lot of rehabilitation programs being designed for people with scoliosis based on the model that it is a muscular imbalance. And you can even see people doing bodybuilding who have scoliosis, and you can see, despite the fact that you may do lots and lots of muscle exercises, scoliosis is not always just because of muscles. Now, there are different types of scoliosis conditions which are due to muscular pathologies. For example, you have muscular dystrophy or muscle pathology, where it does cause scoliosis in that sense. But once again, in today's topic, we are mostly talking about scoliosis in the realm of what we call idiopathic scoliosis. Okay? Now, the other school of thought is that you have scoliosis and it's due to your nerves. Now, when we talk about nerves, we're talking about everything ranging from your brain to all the nerves to the very little toe. And in this case here, you even have people talking about hormones in your nervous system, for like melatonin. So people say that if you have lack of melatonin, which tells you if it's night or day, then it can cause scoliosis, which is really not always the case. But yes, it is true that there was a study done on rats and mice, and they found that sometimes with melatonin deficiency, it can cause scoliosis. But in most cases, with the scoliosis that we're dealing with, you can't just isolate it to one or two schools of thought. So some of the nerve conditions we look at is that, yes, it is true, once again, there are pathologies of the nerve that can actually cause scoliosis. But once again, we're dealing with idiopathic today, and I will explain later what is idiopathic. So one of the things we look at is that we call it the nerve impingement syndrome. And many practitioners will talk about scoliosis and say, look, your nerve is being pinched, and therefore it causes irritation in that area. So for example, if I'm looking at a nerve like this, and, oh, actually, can you see me if I got share screen?
Yes, yes, we can see you, Dr. Fong.
Oh, wonderful. So if you look at the spine, that's what the spine looks like. You have the lovely bones over here, the disc, and that's the nerve right here. So if your spine gets tilted, it does irritate or pinch the nerve, as they say. And that nerve goes to every single muscle, organ, whatever you can think of. So if, let's say, my spine was pinched on the left side, then all the structure on the left side will have some form of irritation there. And that can cause muscle irritation, muscle tightness, which once again can cause the spine to tilt. But that in itself is what we call entalgia, where you're leaning either into the pain or you're leaning away from the pain. So that is more of a postural response rather than scoliosis itself. Then you have other conditions such as issues with the ear and your eye. So in order for our body to balance, you need to have this input from your eyes and your ears, which we call the ocular vestibular reflex or vestibular ocular reflex, where you need to look at the horizon, and it balances out with the ear inside your, with the water inside your ear. And it sends signals to your brain that you are either on a level ground or you're tilted. So if you do have scoliosis, your head is tilted to one side. So the information going into your brain causes confusion between your eyes and your ear. So your spine would tilt to try and maintain horizontal. Then you also have problems with the joints, your muscles, and all of this can affect how your brain functions. And that will also affect your postural muscle, which would then cause imbalance in your body. So another school of thought is that you have scoliosis because you have some sort of a nerve issue. And there's a lot of rehabilitation programs being created where, for example, like in this simulation here, a lady will be placed in the middle. There's vibration at the bottom. She's been placed in a harness. And you have this huge, large TV screen in front of you. And that TV screen can spin. It can actually tilt. And it will actually activate a stimulus into your eye. And it will give you a sense as if you've been flipped around. So that is actually one of the rehabilitation programs for it. So the other school of thought is that if you have scoliosis, it must be a bone problem. Now, as a background, my background is medical science and chiropractic. So I know that there's a fair bit of chiropractors who are presenting today, or physiotherapists or osteopaths. And in your training, one of the things you learn is that we look at things like misalignment of the spine. And if you look at an x-ray, the way they calculate this is they look at this x-ray and say, look, if you look at this bone, it is horizontal, but the one above is tilted. So if you look on the right side, or in this case here, we're looking at the left side of the spine. So you can see that there's a air pocket here that is for the stomach. So we're looking at the left side. So you can see the spine is tilted to one side, therefore everything above it is leaning. And then somewhere along the line, your body decides, I don't like this. And it's going to try and compensate and lean back the other way. And so everything above will straighten up. And along the way, oops, too much. It'll spin. And it'll try to tilt and bend one more time to try and restore balance. So this is the theory behind where you always hear people talk about the bone out of place type of phenomena. Another one you're looking at is the spine from the side view. So when you look at the spine from the side view, you can see the bone on the top here has actually shifted backwards relative to the bone in front. Now, there are conditions called Lateralized Thesis where the spine does shift either forward or backwards, and even side to side as well, which we'll address. And yes, it can irritate the nerves, and it can also affect your spine and your posture. But once again, it is not the only thing that causes scoliosis. So you can't really look at scoliosis and say it's purely a muscular issue, or it's a nerve issue, or it's a bone issue. Then you have conditions like this. This is known as lateralized thesis. So where you can actually see this bone right here, as you can see, it has completely shifted off to the side relative to the bone below and the bone above. And once again, over time, you get wedging on the side of the bone right here. And you can actually see what happens in this case here, the spine will start to tilt. So once again, this is a different type of scoliosis. Now, so one of the theories behind scoliosis is that when your spine starts to tilt over a long period of time, it will start to compress the bone, and your bone will start to wedge. So this is actually where the first myth, one of the myths, it turns out, that your scoliosis causes the bone to wedge. In actual fact, it's not. It's actually the wedging of the bone that causes the scoliosis to form. And we'll come to that, okay? Now, this is actually something that was interesting because in 1992, the Canadian government wanted to find out what causes scoliosis and how do you treat the scoliosis. So a lot of money was poured into this. So you can imagine, 1992, $12 million was actually, it was a research grant. And one of the things they found was that it is a genetic issue. So you always hear people talk about scoliosis as being an idiopathic. And basically the word idiopathic means we have no idea what causes the scoliosis. Okay, we don't know where it came from, how it got there, how to manage it appropriately. So it is a mystery. So that's why we call it idiopathic. Now, when we talk about genetics, I know some of you are probably thinking, oh my goodness, it's genetics. You know, you can go and blame your mom and dad for it. It doesn't work like that. Because we do see a lot of cases where mom and dad does not have scoliosis, but all the children have scoliosis. Then you have other cases where mom and dad may have very, very bad, severe scoliosis, and where mom has had surgery twice already. And yet, all the children are perfectly normal. But however, if let's say you have a very strong family background of scoliosis, and you happen to have scoliosis, some of the studies actually claim that there's a possibility of 30% inheritance there. So when we talk about genetics, we're not really talking about, you know, you got it because of your mom and dad, but that actually comes down to how the spine develops. So if you look at your spine, so next time you have, you know, ossobuco, or you have oxtail soup, or you have, you know, lechon, you know, and you look at the bone. So you can have a look at this bone here. This is your spine. And you will see where these two arrows are. These are you see three lovely structures over here. This is actually the area of the spine where it grows. So genetics actually does affect this part of the spine. So when we look at how the spine looks from the top view, this is actually a part of the spine in the mid-body. So you can see that this big circular part here is the front of the spine. And depending on which part of the spine it is, if it's up in the neck, it looks more like a kidney being in the mid shape, and down at the lower part of your back, it's more round. And then you have these two structures this structure in the back here. It's known as the spinous process. It should be perfectly perpendicular to the front. And if you look at the two on the side, they look like wings on an aeroplane. So these are known as transverse process. And they should be angled. And once again, depending on which part of the spine you're looking at, they should be perfectly symmetrical. You can see this structure looks really nice. It's all symmetrical, nicely balanced. Now, in the case of scoliosis, we mentioned before that people actually say that scoliosis is a bone problem. And people actually say that, oh, it's because your spine was twisted to one side, or it's tilted, or it was rotated, and it causes scoliosis. And unfortunately, that's not the case, because when they did the studies, what they found was that if you look at a spine, you can actually have the spine completely change shape. And you can have this structure right here. Once again, this is the front of the spine. And that structure, if you look at the structure in the back where I said it was supposed to be like an aeroplane wings, you can see they're not sitting symmetrically to that circle right in the front over here. And this structure in the back over here is supposed to be perpendicular to the circle, and you can see the back of the spine is twisted off to one side. So one of the things you notice is that for a lot of people with scoliosis, if the scoliosis is up in the upper body, have you ever noticed that one side of the rib sticks out more than the other side? And it's because your body, as you start to have scoliosis and it starts rotating, the bone gets distorted. And the shape of the ribs, they're supposed to look like C-shape on both sides. But over time, as the spine starts to rotate and there's deformity there, the shape of the bone changes. So you'll notice that on this side here, that C curve is quite sharp. Whereas on the opposite side, you can actually see that that looks less acute than the one on the convex side. So the concave side here, the C shape seems to be much larger, and on the other side, it seems sharper. So this is one of the reasons why when you look at someone with scoliosis, especially if it's in their upper body, they may have that prominence. So when they're bending forward, one side of the spine sticks out more than the other. And the shoulder blade also gets pushed over to one side. So once again, if you're comparing what the x-rays look like, the one on your right side is a normal spine. And you can see the structure nice and circular in the middle here, perpendicular in the back, and the side to side, the wings are nice and symmetrical. But if you look at the spine of someone who has scoliosis, the structure is completely changed. So when we deal with scoliosis, it is not because of a bone that is out of place, or a bone that is rotated or tilted, or that bone is imbalanced because of muscles pulling more to one side than the other. So it's not an issue of tug of war, or a case of the nerve is not behaving, so it's irritating the muscles and the structure on one side, therefore causing the spine to tilt. It is actually a true structural problem. And once again, it is not because of the spine being tilted that it's causing the spine to bend or to tilt, or it's actually causing the bone to wedge. It is actually the deformation of the spine. The spine starts to get deformed like this, and that's actually what causes the scoliosis. And this was actually something that was interesting during the study in 1992, when they discovered that this is actually one of the early process of scoliosis. Now, when you look at scoliosis, you can see, for example, two different x-rays over here. If you look at this structure in this area, you'll notice that this bone right here looks like a wedge. So your spinal bones are supposed to look like a very nice symmetrical rectangle, or in some cases, a square. But in this case here, you can see the left side is more wedged than the right side. Now, if you look on the opposite side, you can also see, look at the structure of these bones here, and look at how compressed they are compared to the bone above and below. Now, another thing is, when you go for your x-rays, you usually turn up to the doctors and you have an x-ray that looks like this. Lots of marking all over it. Have you ever seen that? Yeah. So some of you are waving your head. Okay. So in this case here, when you look at scoliosis, you usually will see x-rays where you've got all this marking, all this writing all over it. And you're probably wondering, what are you looking at? And you're wondering, what does that angle mean? Like over here, you can see it says 53 degrees, 47 degrees. You see all those little markings over there. And you're probably wondering, when you get an x-ray, it looks quite mysterious. So we'll break it down. So if you're looking at an x-ray, one of the first things you have to do is to mark it. And you look for the bone that is the most tilted. Now let's have a look at that. If you look at this green one, is it more tilted than the blue one? Or is the red one more tilted than the blue one? Or maybe this orange one is more tilted than the green one, than the red one. So when you mark an x-ray, you choose the most tilted bone, which is the red one, and then you draw a line 90 degrees to it. So after this seminar, hopefully you can go home, pull out your x-ray, stick it against the window, and mark your own x-ray, okay? And see whether you can do this and does it match what the doctor tells you. Because this is one of the things that's very important. If you don't get this measurement correct, the way you treat and manage the scoliosis will be changed quite fundamentally, because the size of that curve determines what type of treatment you're supposed to get. So if you look at the next bone, let's have a look at that one. Is that more tilted than this blue one? Or perhaps the red one is more tilted than the orange one? So once again, we can see this red one is more tilted than the others. You draw a line 90 degrees, and you get this nice crossover. And then you repeat the same process and see how many curves do you have. Do you have one curve, two curves, three curves? And once again, in here, we can see this red one is the most tilted. Draw a line 90 degrees, and it'll give you two angles. Angle number one, angle number two. So in the case of this x-ray, you've got two different angles. Now, the other thing is, when you look at an x-ray, you try and look for the bone that is the most horizontal in that curve. And which one is the one that has shifted the most to the side, which in this case is this bone right here. And then you do the same thing for the bottom. And that is actually known as the apex of the curve. And then for the bottom part, you do exactly the same thing, and that's called apex. So now you have two apices. So in some cases, if you look at scoliosis, you may have two curves, three curves, and you look for all the different apices or apex. And this is actually very important because the size of the curve, the number of curves that you have, where the apex presents, it will also tell you what type of scoliosis you have. So if you have a curve between 0 to 10 degrees, that is considered normal. So which means that anything above 10 degrees is classified scoliosis. Now, when you take an x-ray, there's always a magnification factor of plus or minus 5 degrees. So that is one of the reasons why we usually don't do anything until that curve goes beyond 15 degrees. So in that case there, if you're between 15 degrees to 29 degrees, that curve is usually quite manageable. And in the past, they would usually just leave it alone and say, look, let's just observe it and we'll get to that. Now, the other thing is, recently there's been a lot of studies behind what should we do about these curves. If you're between 0 to 30 degrees, usually it is considered as being manageable, which means you can do something quite conservative, you can do some exercises, you can do some sort of rehab, and that would be more than sufficient. But in some cases, this type of curve actually does become more progressive. Now, when you go past 30 to 40 degrees, this is actually where you need to have some sort of intervention. So bracing is usually recommended, but what type of brace? Do we use hard brace or do we start using soft brace? And then anything more than 40 degrees, the recommendation is usually surgery. Now, this is actually where it gets very interesting as well, because different countries have different guidelines. So for example, if you're in Asia, 40 degrees will be the cutoff point where they said, look, anything beyond 40 degrees, you need to have surgery. But if you're in places like Australia, UK, America, sometimes they may wait until 50 degrees or so before they intervene, okay? So once again, once you've marked the x-rays, you've seen the different type of curves, where the apex are, that will tell you what type of curve you have. Now, previously, we were looking at the curves and we said that, look, there's only one curve in the top, one at the bottom. Maybe you might have two curves, three curves, or hunching. And it was in 1992 when they did this study, they realized that there is actually more than just 7 different types of curve. And that model where they use the 7 different types of curves has been around for over 50 to 75 years. As a matter of fact, almost 100 years now. So a lot of treatment, a lot of management programs, bracing was actually based on that 7 to 8 different model. In fact, what they found was that when they did the study and they found out that, look, you can have more than just one curve. And let's say you have two curves. You might have one curve in the upper body, one in the lower back. For some patients, they may actually have two curves in just the upper body in itself. Or you can have three curves. You have two in the upper body and one in the lower back. And from there, they realized that if you're an adult, there's 12 different types of curves. And that's actually quite interesting because previously, if you were an adult and you had scoliosis, you'd be advised to do absolutely nothing about it, do some exercise, or if it's really bad, go for surgery. And you're usually told that bracing for adults is absolutely pointless. And there is some truth behind it, but that was actually because of the hard brace. So a lot of advice that was given out was actually based on the hard brace. And so when the soft brace came out, then it completely changed a lot of the ways that scoliosis was being managed. Now, so once again, if you're an adult, there's 12 different types of curve. And if you're a child, there's 27 different types of curve. So all in all, you don't have 7 or 8 types of scoliosis. You got 39 different types of scoliosis. And you need to be able to classify what type of scoliosis you have. And this is extremely important because when it comes to treating scoliosis, you need to be absolutely specific with what type of scoliosis you have, how to treat it, how to manage it, and how to brace it. So if someone has a double curve, you can't assume that, oh, look, you have a double curve, we use the standard double curve method. Because you need to find out if someone has a double curve, for example, one curve in the upper body and one curve in the lower back, which one is the primary curve and which one is the secondary curve? Because by knowing which one is primary, which one is secondary, you are able to address the condition more specifically. So you need to target it. So this is where the best practice principles came in. So whenever it comes to scoliosis, we look at different guidelines. So you have what we call the SRS guideline and SOSOT guideline. So basically, you're looking at surgical and non-surgical guidelines. So if, let's say, someone has scoliosis, one of the first things you have to look at is this a surgical condition? And if the condition is a surgical condition, then it falls under the SRS guidelines, where they will talk about the best ways to handle it surgically. And if you're non-surgical, this is where we look at SOSOT. So this comprises of everything from orthopedics, rehabilitation doctors, different rehabilitation techniques. So you've got 2 different ways of looking at it, surgical, non-surgical. Now, the other thing is, if you have scoliosis and it's more than 40 degrees, let's say we're looking at Asia, and it's more than 40 degrees, one of the biggest issue is that we get a lot of people who assume that, look, I have scoliosis, I don't want surgery. I want to absolutely avoid this surgery. Okay, and they're looking around all the different options out there, hoping that they can avoid the surgery. And they will go for different types of treatment, different types of therapy. And one thing you have to understand is that scoliosis is time critical. So if I'm looking at a child and the curve is quite large and the curve is increasing at, let's say, more than 1 or 2 degrees a month, you don't have a lot of time to play with. You need to address it very, very aggressively in that sense to try and keep it under control. It's like fire. When the fire is small, you try and squash it. You don't wait till it becomes a bonfire, then you start to do something about it. So when it comes to surgery, a lot of people, as much as it sounds quite daunting, surgery is actually something that can be a lifesaver. And depending on what type of curve you have, it is probably the only option that is available. But if, let's say, your curve is quite large, and this is actually where, when we go around the world training people how to do spine core or scoliosis bracing, every single practitioner is trained and taught about the different guidelines of how to manage and treat scoliosis. So if, let's say, I have a patient that comes in and has a very large curve, and they've been to a specialist, for example, a spinal surgeon, and the spinal surgeon may look at the curve and say, wow, this is a 55-degree curve. Yes, it is actually a surgical curve, but the surgeon may, for some reason whatsoever, done his assessment and felt that this does not warrant surgery. So under those circumstances, this is where, let's say, someone who's done spine cord training would be able to say, okay, so this is a surgical condition. We're going to try and treat this non-surgically first. And so this is actually how you manage it. But in some cases, if it's more than 40 degrees, you do need to have surgery. Now, if, let's say, someone who is more than 40 degrees, and then the surgeon said, look, we shouldn't do surgery yet, let's explore other options. Now, this is where we're dealing with non-surgical type of intervention. So when we look at and going back to surgery again, when we look at non-surgical intervention, one of the things that the doctors will look at is that, look, you need to have surgery, but we probably won't do any kind of surgery for now. Let's brace you first, or let's do some exercise to see whether it can slow down the scoliosis or stabilize it before we go for surgery. And it was actually quite interesting because in 2019, in January, there was a study that was found that if, let's say, someone had scoliosis, they were supposed to go for surgery, and they decided that they were going to do some sort of bracing. The bracing, especially in this case here, we were talking about spine cord, they found that the patient wearing the brace before the surgery was able to recover faster in terms of restoring back balance. So in some cases, depending on what type of brace you're wearing. Now, if, let's say, you are wearing a hard brace before your surgery, you'll be wearing the hard brace for, on average, as prescribed, 23 hours a day. So a lot of patients wearing this brace, they've been restricted, there's no movement, and over time the muscles become quite weak and it becomes lazy. So when they remove the brace, the muscle tone tends to be quite weak. So if they do surgery, then suddenly they're told that, look, you need to stand up and start walking around the ward. The spine tends to be quite unbalanced in that sense because the muscles have not been used for quite a while. Whereas if, let's say, they were using a dynamic brace, the dynamic brace activates muscles, so it maintains the muscle tone. So after the surgery, that muscle is still able to activate. So that was actually an interesting study where they found that after the surgery, if you've been wearing the brace, you actually do recover faster in that sense. Okay, so the next thing we look at is that if you're looking at something that is non-surgical, there's other options. Now, besides bracing, one of the other options is the most common. What type of brace are we looking at? You've got rigid braces, you've got soft braces, and there's so many different types of braces out there. Okay, so it's kind of like going shopping and trying to find out which one it is. Now, the problem is when it comes to bracing, you need to know what type of scoliosis you have. A lot of the rigid braces were actually based on the previous model where the understanding of scoliosis is more, well, if you're tilted, let's untilt it. If you have rotation, let's reduce the rotation. And the studies actually came out where they found that just trying to use pressure. So when you use a hard brace, it's based on what we call 3-point pressure, where if, let's say, I'm hunching, the brace will be used to push you from the back or the front to try and straighten you out. Or if I'm tilting more to the left or the right, the rigid brace will be designed to try and straighten you out from the side posture or rotation. And they found that over time, that actually did not work. So although it provided you a very good structural support, it did not change the scoliosis as such. So the dynamic braces, there's many different types, and some of them are hybrid braces or variations. And they've found that in some of these cases here, that some of the soft braces does not work. And so once again, if you're looking at rigid braces, soft braces, it's not to say one is better than the other. It's more what type of scoliosis do you have. For example, if your scoliosis is growing quite aggressively, a soft brace might not be the answer because it is not strong enough to halt it. But if your spine is in its early stages or you're in that moderate range and the spine is still growing, then using a dynamic brace would be better than using a hard brace. But once again, you do need to have an assessment before you do that. Okay? Now, when we look at rigid braces, there's many different types. And this is where, remember before I was showing you how to mark an x-ray, and we talk about the different apex of the spine. So in your neck, you have 7 bones. Your upper body, you have 12. The lower back, you have 5. So in the mid-back, they usually call it T1, T2, up to T12, which represents the thoracic or the thorax. So we usually look at the apex point, what we call number 7. So anything below number 7, you use braces like the Boston brace and all that. Anything above number 7, we use things like Milwaukee brace, which goes all the way up to the neck. And I do know that some of you probably have used these braces before, and unfortunately with hard braces, the compliance is not there, okay? So sometimes when it comes to treatment, if you don't use it, you don't see the results. Now, spine cord brace is actually a soft brace, and there's different versions of it. So this was the original brace that was used, which is for children. And then over time, it was modified. And then this is actually an adult brace for pain management. And then this was a brace that can be used across the range from children to elderly. So the youngest patient we have so far is 4 years old, and the oldest is 90. So when it comes to scoliosis, you can actually have many different types of patients of different walks of life. Now let's talk about non-surgical. One of the first options is that if, let's say, your curve is below 40 degrees, one of the first options is that you are told to observe and monitor this condition. So this is where you'll be told, let's come in, let's have a look at your posture, let's measure your spine, do a tilt, bend over, let's see how much rotation you have. And then you'll be told to go away, come back 6 months later, have another x-ray. After 6 months, take another x-ray. Monitoring. There's no treatment, there's no intervention. And one of the biggest problems with this is that if a child is growing, that spine is not going to straighten itself out by itself. So just like a tree, if a tree is already tilted and you leave it sitting there, that tree is going to continue bending. And just popping up every 6 months, having a look at it, is not going to do anything. So you need to have some form of early intervention. And this is actually where they found that if you do something in the early stages, you can successfully address this condition. And there was another study done. So previously, if you were dealing with hard braces, it was recommended that if your spine is between 15 to 24 degrees, don't touch it. The idea was to wear a hard brace and your curve was very small. Your muscles will become weaker. Your spine will become unstable because over time your muscles become very lazy. And so if you're going to wear a hard brace between 15 to 24 degrees, that was not encouraged at all. But back in 2008, this is actually an interesting study. They found that if you use a hard brace, you're wearing it for 23 hours. That was not recommended because within that 23 hours, your spine develops very bad habits and it destabilizes. It becomes very weak, lazy. So what they did was that they conducted a study that took 14 years. And this study, as you can see, was conducted on over 615 patients. So for 14 years, they followed these patients. And what they found is that if you brace them in the early stages, the success rate is 88.6%. And they were able to follow these patients up within 2 years and 5 years. And they found that if you were going to treat these patients in the early stages, you have a much better success rate. So it's pretty much like patients, if you feel a lump in the chest area, you don't wait for that lump to become a size of a tennis ball before you remove it. So in the early stages, while it's still contained, you can address it. Now, there was another study again where they were trying to see what happens if we address and we have early intervention. Do we leave it or do we observe? And it was actually quite interesting. This one here, they used 150 patients. And what they found was they were using the SRS criteria, which means they followed the patients through for the full 2 years that they were wearing the brace. Then for the next 2 years, they did not wear any brace, and they did another follow-up to see whether there were any changes. And what they found was that patients who had early intervention had a better outcome. So once again, if the curve is quite mild, don't wait for the curve to become larger before you do something. So the moment you see the posture change, or you notice the imbalance, for example, at the beginning of the seminar, I was talking about how you observe for postural changes. So bear that in mind. And this is a condition that tends to affect young ladies more than men or boys. Now, previously, it used to be a ratio of 1 to 5, that girls were 5 times more likely to have scoliosis. And then recently it became 1 to 8, where girls would have scoliosis 8 times more than boys. And internationally, it is understood that it's about 1 to 10. So women or girls are 10 times more likely to have scoliosis than boys. But that being said, if boys do have scoliosis, it can be almost 5 to 10 times worse than a girl. See, so some people say God is fair. So it's not fair. And it's not because that you're a boy, it's going to grow more aggressively. When it comes to screening programs, there's more programs out there screening girls. For example, in your school, if you can recall this, when you're in school and you're having your spine checked, quite often you'll find that the nurses, the doctors will come to your school. They will have all the girls lined up, and then they ask you to bend over, and they check you one by one. Now, for all the male participants today, if you think about it, have you ever been checked? And most likely the answer is no. No one ever checks boys. Okay, well, they're not interested in boys. Okay, so in this case here, by the time scoliosis is detected in men or in the male population, it has already developed, it's become more established. So which means that you've missed that critical period. So once again, when it comes to scoliosis, the earlier you detect the condition, the more likely you are able to address it. So once again, this was a research paper that was published in 2018. And what they found was that should you wait, or should you watch and wait? And they did a long-term study into this, and they found that if patients had early intervention, once again, that early intervention is far more superior than just doing observation and monitoring. So once again, and a lot of people say that, look, but if I have this early intervention, that means I'm going to go for more x-rays. But once again, the exposure from radiation and the benefit from treating the scoliosis far outweighs the harmful effects. Okay? As a matter of fact, if you go for digital x-rays, it's almost equivalent to almost, so is actually quite low. Now, the other thing is, if you do have scoliosis that's below 40 degrees, other than observe and monitor, the next advice is to do rehab or exercises. And quite often you're told, go to the gym, do some yoga, Pilates, or the most common, let's go swimming. Now, swimming is a very generalized type of advice given. In fact, if you have high blood pressure, you're told, go swimming. If you have cholesterol problems, go swimming. If you have back problems, go swimming. You have scoliosis, go swimming. You have emotional problems, go swimming. It is a very safe type of sport to recommend, because what's the worst that can happen? You might drown, but you're not going to injure yourself. So when it comes to exercising, these type of exercises are quite generalized. So unfortunately, it is not going to be targeted to the type of scoliosis you have. So when it came to exercises, they found that general exercises are not really that beneficial to the scoliosis. It is good for the body though. So it's good for your general health. So one of the things that came out was what we known as PSSE, or physiotherapy or physiotherapeutic scoliosis specific exercises. And then there was another interesting one that came out. Oh, hello, Shane. Yep, I'm just going to mute you for a while. Yep. Okay, so there was another exercise that was presented. So in 1992, when they discovered about spine core and all that, there's something called corrective movement principle. And they found that different parts of your body respond differently to the way your body moves. For example, if I'm looking at the mid section of the body, if I had a tilt in the midsection, previously the idea was that to straighten out your spine is just push it. If you push it from left to right or right to left, that should straighten out the spine. And the truth of the matter is, no, it doesn't. So if you have a curve that is in the mid part of your body, so in the upper body section, the way you reduce that curve is actually rotation, which is actually quite interesting. And if you have a curve in the lower back area, the idea used to be to try and push it. And the answer is no, it doesn't. You need to tilt it, okay? Or you need to translate and tilt. So once again, during the studies, they found that different parts of the body, in order to reduce the curve or to address the type of curve that you have, it comes down to a specific movement. So this movement was known as corrective movement principle. And that is actually how the bracing was developed. So it was from knowing how the spine behaves, how it moves. It is not about pushing that bone from left to right or back to front. It is actually about how you move that bone to address the type of curve that you have. Now, what is actually interesting with this one as well is that they were using, and one of the ways they did this experiment was that they had patients who were quite large or obese. And to prove a point, if a patient was obese and you put them in a rigid brace and you try to push that spine from left to right, it did not have a very good success rate. But if you use the same patient and you use, let's say, a dynamic brace where you're not pushing and pulling, but you're changing the movement, it was successful. It had a far better positive outcome in reducing the curve. So once again, when it comes to treatment of the spine, it is not about how hard you push the spine from left to right. It's about correcting the movement. And this was a study that was done on 583 patients. And this study was conducted over, let's see, over a 2-year period. And in this case here, sorry, it was an international study that was done on 639 patients. And what they found was that by using the principle of corrective movement, they found that after 2 years, 93.2% of those patients had a positive outcome. So that is actually quite a large success rate. Now, so once again, when it comes to exercising, general exercises are good for your body, but it is not specific enough for your scoliosis. Now, the third option is that if you're going to have treatment for scoliosis non-surgically, the third option is to have bracing. Now comes the problem. What type of brace are we talking about? Hard brace or soft brace? So once again, if we talk about hard brace, there's different types out there. And there's dozens and dozens of different types of hard brace. As a matter of fact, most of these hard brace are literally exactly the same. They have different names. So you may have a designer come up with one that has a bit of a hybrid in there, or it's designed to push the body more from left to right or more front to back, and then they name it after themselves. Pretty much like when you're going on some sort of expedition and you discover something, you name it after yourself. Now, when it comes to rigid bracing, one of the most interesting things is that when they look at rigid braces, once again, you have to wear the brace prescribed for 23 hours a day. And over time, with a lot of rehabilitation doctors or the seminars that we give, they say the same thing. If your spine does not move for 23 hours a day, and then you are told that you have to take off that brace and then exercise for that 1 hour, that 1 hour of exercise is not sufficient enough to reactivate or maintain muscle tone from zero movement for 23 hours. And a lot of times, these exercises that's been designed for people with hard braces is mostly about pushing the bone left and right, but it's not about movement. So once again, you're trying to encourage movement, but you're restricting the movement. So it's kind of an oxymoron, so kind of a paradox in that sense. Now, when it comes to soft brace, I will mention this, the soft brace was actually designed based on the corrective movement principle, which means that when we look at scoliosis, do you remember we said that the hard brace method was based on the 7 to 8 different models of the spine? The soft brace was based on the 39 different classifications, Because in 1992, they discovered that there's 12 different types of curves for adults, 27 for children. So you need to know exactly what type of curve that you have, and you need to address it specifically. Now, if you're looking at all these braces, all these elastic bands over here, they have different configuration for each and every single type of curve. And the good thing, if you compare, let's say, a hard brace to a dynamic brace, if your spine changes, you need to make another brace. And one thing about the hard brace is that you have to wait for 6 months at least before you change to a second or third brace. With the dynamic brace, you don't have to. You can wear the same brace every time your spine changes. You just have to change the configuration of the brace, and that's all you need. Or if the bands need to be replaced, you just replace 1 or 2 bands, or just some of the components. Now, when it comes to the hard brace and the rigid brace, this is actually an interesting study. And this was actually done in 2007 in the Journal of Pediatric Orthopedics. They found that if you were to embark on bracing, let's say you're not suitable for surgery, or your spine is not that large or severe enough for surgery, then bracing is usually recommended. And there's 2 types, hard or soft brace. Now, during this study, it was quite interesting that they found that the hard brace was only 15% effective. And what was actually more startling was that 79% of patients who wore the hard brace ended up having surgery. And it's not because the hard brace makes your spine, become more surgical. It's the fact that if you wear the hard brace, the spine is not supported. So every time you move the brace, there's really not much muscles or strength there to stabilize it. So over time, the curve gets worse and worse and worse. Now, what they found that was quite interesting is during this study here, they found that with the dynamic brace, this was tested on over 400 patients over a 10-year period. So this was not a small research study done on just a few patients. This was done on over 400 patients over 10 years. It was found to be almost 4 times more effective than a hard brace. And for patients who do have to have surgery, it was 3.7 times more successful in stopping the surgery than a hard brace. Now, this is not to say that wearing a soft brace will guarantee that you don't need surgery. That is not the case. But if, let's say, someone's spine is slowly progressing or it's actually developing at a certain rate, and they are trying to delay the surgery, or let's say the surgeon has decided that, look, you do have scoliosis, but your surgery will have to schedule it for 6 months later. And you have to choose a brace to at least stabilize and support that spine before the day of the surgery. And if you had to choose between a hard brace or a soft brace, the soft brace was found to be almost 4 times more effective than a hard brace. Now, there are times when we look at a patient and the patient's spine is progressing quite aggressively, and it is deteriorating at an aggressive rate. Now, for those cases, we will usually recommend a hard brace. But for most of the other cases, we will usually use a soft brace. So once again, before you decide that, look, I don't want surgery, I'm going to absolutely avoid surgery as much as possible, don't do that. Have a proper assessment of your spine first to find out what type of curve do you have. Is surgery warranted, or can it be delayed? And usually for that, you do need to talk to the spinal surgeon. And it is the spinal surgeon or the specialist who will be able to tell you and give you advice whether or not this is something that you need to do quite urgently, or you can wait a little bit longer, okay? So this was actually interesting because after they did the study, this was a worldwide study, and they found that the dynamic brace was 89% more effective in treating and addressing scoliosis than using a hard brace. That was actually quite shocking, isn't it? So in many cases, for many years, we've always been looking at braces. And whenever you think of braces, you think of a hard brace. And this is actually one of the reasons why, if let's say you do have scoliosis and you went to your doctor, the moment you have scoliosis, quite a lot of times the doctors will usually say, look, you have scoliosis, don't wear bracing because it's not going to work for you. Okay, or your curve is too small, it's below 30 degrees. Don't wear the brace, it's not going to work. or your curve is too big, don't wear the brace. And once again, they're referring to the hard brace because for many of the doctors that we train or when we give seminars, for example, recently I gave a seminar in an orthopedic convention. And when we spoke to the orthopedic surgeons, one of the comments they have is, well, my professor was the one who told us that if it's below 30, we don't do anything about it. And when you talk to the professor, they usually say, well, that is the way we're taught. And whenever they attend seminars on orthopedics, it's usually about surgery. So when it comes to things like bracing, the understanding is always based on rigid bracing. So what is actually interesting about spine cord brace is that it was actually developed and invented by orthopedic surgeons because there was a need for it because they found that the hard brace was not working. And that is actually how it was developed. Now, another interesting study that came about was that how do you manage scoliosis? And this was actually a study from 1993 to 2011. So this study was conducted over 18 years. 390 patients were presented, and they did a 2-year follow-up. And what they found was that within that 2 years, 86.1% of patients who wore the soft brace were either stabilized or had their scoliosis angle corrected. And even after they stopped wearing the brace for 2 years, 11.7% of them continued to improve. And one of the reasons for this is that the biggest difference between a hard brace and a soft brace is that a hard brace pushes your spine into a so-called ideal position. And the idea behind it is that if your spine is tilted to the left, let's push you and try and straighten you up. So there is absolutely no education of your muscles or your bones or your ligaments or your nerves. You're basically just held in place by something rigid. Dynamic brace, on the other hand, doesn't work like that. So yes, it does have a bit of resistance. And in fact, you are pulling and fighting against resistant bands. So during the 20 hours that you're wearing the brace, you are literally exercising. Every single movement is being resisted and guided. So the rigid brace will be 23 hours of zero movement, almost zero muscle stimulation, okay, or coordination or activation. Whereas the dynamic brace will involve 20 hours of lots of resistance, lots of activation, lots of education. So this is one of the reasons why when these patients took off the brace, and for 2 years they did not wear the brace at all, they did not fall back, they did not revert back to the original condition. So 11.7% of those patients continued to improve. So they did another study to find out, okay, what happens if the patients don't wear the brace for 5 years? So once again, they wore the brace for 2 years and then they took it off and they followed them up 2 years later. They say, yep, 86.1% improve, 11.7 continue to improve. But what happens 5 years later? Now remember, you have not worn a brace for 5 years. So quite often you would believe that your spine will slowly shift and revert back to its original type of posture. So what was actually quite startling was that they did a study from 1993 to 2009. So this was 16 years. And during these 16 years, they found that they did the study on 840 patients. So once again, this is not a small study on a limited number of patients. This is a very large study on a huge patient base. And what they found was that after doing this study, after 5 years, 29% of those patients continued to improve. So even though they have not worn the brace for 5 years, almost literally a third of them continued improving. 63.5% of them continued to remain stable. So that was actually quite an interesting study compared to the hard brace, where most of the time you don't see a lot of statistics after the 2 years. And very rarely do you ever see any studies being presented on follow-up 2 years later, 5 years later. Now, so in this case here, within that period for 5 years, only 7.5% progressed more than 5 degrees. And in some cases, only 4.3% ended up having surgery. So once again, the success rate and the positive outcome was quite high for patients wearing the soft brace. So one of the myths that we always hear is that the only way to treat scoliosis is to use a hard brace. So there's a couple of myths that we address today, that scoliosis is not purely just a muscle issue. It is not about a tug of war between the left side, right side of your body. And it's not because of a bone being out of place or a bone being misaligned or tilted. It is actually because of the bone deforms, it changes shape. And it's not because of the scoliosis that causes the bone to change shape. It's like the chicken or the egg. Is it the chicken or the egg that came first? I know some of you are probably arguing the chicken came first, okay? And so in this case here, we're looking at this question of, is it the bone that is being compressed and that's a result of the scoliosis? Or is it actually the bone being deformed that causes the scoliosis? And then when they did the study, they actually found that it is actually the bone that gets deformed that causes the scoliosis, not the other way around. So it is actually quite interesting when they found that. It changes the whole mindset of how to manage. So once again, 5 years later, they found that the positive outcome was found for those patients wearing the dynamic brace, not the hard brace. Now, this was another interesting study. So this is where the purpose of this study was to see, can the spine remain stable after you remove the brace? And a lot of times you have cases where you always hear the myth that you must wear the brace, your spine will become dependent on it, and the longer you wear the brace, the weaker your brace becomes, and you become dependent. So that is usually the case when you're dealing with those low back pain braces. So there was a study done in Canada where the people who were chopping trees, they were wearing a back brace. And what they found was that if you have back pain and you wore the back brace, the more you wore the back brace, the weaker your spine becomes. So you end up becoming dependent on it. Now, when it came to the brace, that was very interesting as well, because when it comes to the brace, one of the first things you look at is, are we talking about the soft brace or the hard brace? If you wear the hard brace, then yes, over time your spine becomes dependent. And the first few weeks you wear the brace, and for all of you out there who has ever worn a hard brace, the first time you wear it, you feel almost invincible. You have this rigid brace that's pushing your spine, and suddenly you feel like Iron Man, that you have an armor, and your spine feels quite strong. And that is the usual impression that, wow, I'm standing quite straight. Something is holding me up. But over time, what happens? You start to notice, exactly. You start to notice your muscles becoming weaker. And instead of the brace pushing you up, you're now leaning into the brace. So as time goes by, your muscles become weaker, your posture, your spine becomes a little bit more, well, you can say you lose muscle tone. So now you are pushing into the brace, almost like you leaning on an armrest on your chair just to keep yourself up. So over time, you start noticing bruising or abrasion against the skin. And so over time, what they found was that if you wear the hard brace, your spine gets weaker. So, which is why when you tell patients on a hard brace to take off their brace, it is quite a daunting sort of an idea, thinking, oh my gosh, I don't think I should do that, because if I take it off, my spine actually feels very, very weak. So this study was actually interesting because they wanted to know what happens if you remove your brace for more than 2 years or 5 years. And this study was done over 16 years. So once again, this is a very large long-term study, 16 years, done on 949 patients, literally almost 1,000 patients. And what they actually found was that out of this, 576 patients had a very good outcome. So what they found in this case here is that after 2 years, 14.5% of those patients continue to improve, even though they have not worn a brace. So you can imagine, you've been wearing this brace for 2 years and you suddenly stop. And after 2 years, 14.5% of those patients continue to improve. And 5 years later, a third of those patients continue to improve. So once again, it actually shows that one of the reasons why this is happening is that when you wear the dynamic brace, the brace is not the one that's holding you up. It's educating your body of how to move, how to behave. So that's actually where the principle of the what we call the corrective movement principle comes from. Now, the other thing we look at is that they found that if you wear the brace for 2 years, 5 years, it was able to not only maintain, but to improve the spine beyond the 2 to 5 years. Okay? Okay. So these are some of the international studies. So we touched on quite a fair bit of points already, and one of the things we spoke about is that we talked about scoliosis, and we said that it was genetics. And for some of you who turn up a bit late, this was actually the model of scoliosis. So previously, the idea is that you have scoliosis because you have bad posture. Now, some of you probably have been told that your bad posture is the one that's responsible for scoliosis. True? And I'm sure your mom and dad have been screaming at you for the longest time, telling you that you've been hunching. You see, yep, I see Reezy here smiling. Yep. And you're probably thinking that, yes, my mom's been telling me off that I'm hunching, especially nowadays when you're doing Zoom classes, and you're hunching or you're playing your mobile phone. And you're told that, yeah, you see you've got bad posture. Your bad posture causes the scoliosis. Or is it the scoliosis that's causing your bad posture? So once again, it's the chicken or the egg principle. And what was actually interesting was that there was a study done on this. Is it your bad posture? Does posture lead to scoliosis? And surprisingly, the answer is no. Okay, and I know some of you are probably looking at your mom and dad and saying, see, I told you, right? So, but if you do have scoliosis, your bad posture will make it worse. And once again, how do you know if you have scoliosis? And in most cases, if you've never taken an x-ray, you would not know you have scoliosis. Because as we mentioned earlier, do not rely on your posture, because you can have an absolutely beautiful looking posture, perfectly straight. Your neck is symmetrical on both sides. Your shoulders are perfectly balanced. You have the perfect ideal waistline. And you go for an x-ray and you have a horrendous looking curve. Okay, and we see that quite a lot. And you have patients who come in who have the worst posture you can imagine. But when you go for an x-ray, you're absolutely flabbergasted. You're dumbfounded. The spine looks probably straighter than my spine. I have a straight spine, by the way. When I was young, my mom used to scold me for having a bad posture. So in this case here, do not rely on posture. And when we talk about genetics, once again, don't go and blame your mom and dad for your scoliosis, because that's not the way it works. When it comes to scoliosis, this was actually after doing all those studies and the research in Canada that the two orthopedic surgeons, Professor Collard and Christine Collard and Professor Rivard, they found that when you are growing, there's parts of your body that continues to grow. For example, your arms, your legs, your spinal structure. If there's a genetic fault, the different parts of the bone, instead of growing symmetrically, one side may end up growing either too fast or the other side end up growing too slow. So can you imagine, if you visualize this, imagine you're trying to build a large building and you have two buildings, one on the left side, one on the right side. The people on the right are building this large structure faster than those on the left side. Then over time, one side gets overwhelmed. And that's exactly what happens with the spine. So the first thing that happens is that you have a genetic fault. It affects how your body grows. So you may end up with one side of the spine growing faster than the other, relatively. And because of that, the shape of the spine changes. So if you can recall previously when I was showing the x-ray images, the bones, instead of looking nice and symmetrical and rectangular, it actually changes shape. And it actually starts to look more like, instead of looking like a nice rectangle like that, it starts to become wedged. So one side becomes smaller than the other. And because of that, the spine starts to destabilize. And the moment your spine starts to destabilize, it affects your posture. So now you need to modify the way you stand to maintain a proper center of gravity and balance. So if, let's say, my pelvis was tilted, the lower part of my spine will tilt into the side that is shorter. And then over time, your body will realize, I don't like bending over to the left. So your body will try to compensate and lean more to the right side. And because of that, you will then start affecting how the muscles behave. So you're leaning more on one side, the muscles on that side will contract. The other side becomes overstretched. One side of the joints get impacted, the other side gets stressed. The ligaments get stretched. So over time, you alter the way your nerves, your muscles behave. So as you can see, your scoliosis is not because of a tug of war between your left and right side. It's the fact that the moment your spine becomes unstable, it affects your posture. Once your posture starts to become disorganized, it then affects how your nerves, your muscles behave. Now comes another problem. If, let's say, your whole spine has been tilting over to the right side over a prolonged period of time, the right side of your body will experience more pressure. So that's called loading. Oops, excuse me for a second. That's not corona, by the way. I'm just coughing from eating too many peanuts last night. I hope all of you are very safe with this pandemic that's going around. Wear your mask as much as you can. Okay, I know there's a lot of people who are anti-mask users out there, but sorry to say, it's common sense. Please wear your mask. Okay, now going back to the bone structure. As your spine starts to lean more to one side, the side of the spine that gets impacted or experiences the most amount of pressure undergoes what we call loading. And the studies actually show that if I was looking at a bone structure that was growing symmetrically, the side that experiences the most amount of loading starts to slow down. So over time, the more you lean into the right side does not grow as fast as the left side. So as time goes by, the left side will grow faster and faster, and that will then affect how your body grows. And unfortunately, this cycle that you see here will start to propagate. And over time, you're looking at basically a cogwheel that you go round and round and round. So the faster you grow, and once you hit puberty, this is actually where it gets very interesting. You see, for men and for boys and girls, it's very different. For girls, the moment they have their menses, within the first 1.5 to 2 years, you don't really see that much of a change. So with a lot of young girls, the moment you have your menses, you probably don't notice any type of increased growth and etc. But then about 2 years later, you start to change, you get taller, you have physical changes in the body. And for boys, it's a mystery. We never know when you hit puberty. You know, you have a little bit of whiskers growing, a bit of beard, a bit of mustache. You notice your voice becoming heavier. But by then, you've already in your growth spurt. So when you hit that growth spurt and your body's growing at a very rapid rate, this whole cycle that you see here speeds up. So the faster you grow, the more you get that deformity of the spine. And the faster your spine grows, the more it becomes unstable. And unfortunately, that will affect your posture. And once again, the more your posture becomes disorganized, it will then affect how your nerves and your muscles and your bones behave. So if you can remember, we go backwards. Is it the nerve problem that's causing imbalance between your eyes, your ears? It is actually not the eye and ear that's the problem. It's the moment your spine starts to become distorted, it then affects your balance, which then affects your eyes, your ears, the neurological firing, the feedback system from your eyes, your ears, your joints starts to become distorted. So your brain gets the wrong information. And once the brain starts to get the wrong information, the way it responds will also be dysfunctional. So unfortunately, what will happen is your body will think, oh dear, I'm leaning more to the right. I'm losing my balance. So it will start to propagate it. And you get what we call positive feedback or negative feedback. And in some cases, if your nerves are irritated, it either becomes excited or inhibited, meaning if, let's say, my nerves are becoming irritated and compressed, and it becomes excited, then you get more firing. So muscles become more contracted, increased blood flow, more inflammation. Or if it's inhibited, that nerve becomes literally almost shut down or shut off. So you get less responses, you get weaker, slower response time, slower firing. So as you can see, this is actually the neuromuscular structure problem. So when we're dealing with scoliosis, it is not because of your muscle or your bone or your nerve. And the studies actually found that it is a combination of all three at the same time. So when it comes to treating scoliosis, you can't just go for a pure muscular treatment. So you can't just have exercises as the only way to treat your spine. You can't have just pure neurological type of rehabilitation to treat your spine, or do you have pure treatment of the bone, having spinal manipulation or joints. You need to have a combination of all three at the same time in order to address this problem. And the idea behind it over time was that they found that if your spine was tilted, you need to be able to open that tilt. And if you wear a rigid brace, it is beautiful in terms of taking a tilted spine like this. If the spine is tilted, it is beautiful in straightening out, but it leaves you in that position. And they found that that bone on this side is not going to grow. So in order for that bone to grow, that bone has to be able to open and close, open and close. It is during that opening and closing that that bone experiences impact. And it's through that repetitive impact, at least 10,000 times a day, that stimulates that bone to grow. So if you are wearing a rigid brace that only opens up that bone, there is no impacting. And they found that if that bone does not get that stimulation, it is not going to grow. So the myth of wearing a hard brace just to purely open up that bone, and the idea was if you take the pressure off that bone, the bone will grow. Because remember we said that if the bone is being compressed, it doesn't grow. So the idea was, okay, if the bone doesn't grow, if it's compressed, then the best way to make it grow is to take pressure off it. And whilst that idea sounds sensible, unfortunately, the science does not support it. That in order for that bone to grow, you do need to have that opening, closing, that compression, that stretching. And rigid braces does not allow that, whereas dynamic brace does. Now, so this is actually where we talked about just opening it does not change the correction, okay? So if you have scoliosis, one of the first things to do is that how do you treat it? So let's say you're not looking at a surgical type of a spine. One of the first things you need to do is that you need to be able to change that compressive force. So if your spine was leaning towards the right side of the spine would be undergoing compressive changes, okay, or forces. So you need to be able to open up that compressed side and allow opening, closing, and loading. Now, secondly, when you do bracing, you need to be able to localize where is the bone deformity. So once again, we were talking about how to mark the x-rays earlier on. So I hope you all remember how to mark your x-ray. So when you go home, you can start marking your own x-ray. Look for where is the deformity. You'll be able to see the structure of the bone change. Instead of looking nice and symmetrical or rectangular, it starts to look more like a wedge, okay? And in this case here, when you do bracing, you have to be able to isolate where is that deformity. So if you're wearing a rigid brace and you're pushing the spine, it doesn't really address where that part is, because if that bone structure is above T7, as we mentioned, they use the Milwaukee brace. But what if you have a double curve in the upper body, or you have a triple curve? It doesn't address that. Now, the other thing is, when we're looking at the spine, you need to, once again, the only way to address that is you have to be able to identify what type of curve you have. Using a 7-curve model is too limited. And this is one of the reasons why in 1992, they discovered that there's 39 different types of scoliosis classifications. And by knowing exactly what type you have, you're able to not only specifically identify where the primary or secondary curve is and how to address it. and also how to apply force into that area without doing pushing and pulling, but rather guiding it, correcting the movement, and to educate the whole body of how to move. Okay. Um, I think we leave it for now. Wow, I didn't realize that we've been speaking for 1.5 hours. I do apologize. Once I start talking, I do get quite enthusiastic. Do you have any questions at all?
I am Ruby Gamolo. I have a daughter who has scoliosis, and she is using Spinal right now. But it happens that these times are COVID times, and she's at home, and because she's at home, it is not regular that she's using the spine core brace. So there would be a time that would be 2 days a week use of brace, and afterwards none. And it just so happened that Dr. Ed of Davao City has stopped the online therapy, the online therapy. So our problem now is, will this will this affect that twice only 2 days a week wearing of the spine core brace and no online therapy and more YouTube and Facebook affect, or will it return to the original curvature that she has? That is my question.
Once again, that's a very good question. One of the first things we look at is that if you have scoliosis and you're quite young, you should be wearing the brace approximately 20 hours a day on a daily basis. So wearing the brace only twice a week is not enough. Now, there was another study done where if you wear the brace for only 15 hours a day, you only have 50% effectiveness. And if the patient can just persist that extra 5 hours, from 15 to 20 hours, that extra 5 hours changes the effectiveness from 50 to 100%. So in this case here, I think your daughter is sitting right next to you, and a lot of young children, when it comes to bracing, they will find every excuse under the sun to try and not wear it. Okay, and yep, see, Dad is nodding his head. Okay, so we do see that quite a lot. And so you do have to wear the brace for 20 hours. And it's one of those things where the treatment is effective. It is able to stabilize, manage. But it will only be effective if you wear it. And you have to be consistent. Now, in terms of doing it online, because of the way COVID-19 has been affected, ideally we do have different doctors around Philippines that does provide the treatment and support. So if, let's say, you are near Mindanao and you are unable to go down to Davao, in Mindanao there is actually a doctor there that does spine core. Or let's say you are in Rojas and you are unable to go to Rojas, then you can always go down to somewhere nearby in that area. Or if, let's say, you're in Cebu and you're unable to see one of the doctors in Cebu, then there's 3 practitioners there. So the files of every single patient is monitored by SpineCore UK and myself. So for every patient that is being treated, we do actually check and we look, and we do maintain quality control in that sense. So we are monitoring every single patient that is being treated. And if, let's say, a patient from Davao decides that, look, I'm going to fly to Cebu and I would like to be treated by one of the doctors in Cebu, then you can actually request your practitioner to transfer the file to the doctor in Cebu. So you can always find someone close nearby. If let's say you're not sure where is the closest person to you, you can always contact Scolio Care Corporation, and they will always find someone nearby for you. In terms of online treatment and everything, the exercises, you can actually do the exercises online. It shouldn't be an issue. It's more about the intensity of how you do it. So I do understand from Dr. Ed, he's actually a very good bracer, and he does excellent exercises, and he has a background in physiotherapy, so he's able to give very good advice on how to do it. So, but of course, once again, when it comes to bracing, because one thing about spine core bracing is very much like bracing for your teeth. on a regular basis, in this case here, once every 3 months or so, you need to modify the pressure, the tension of the brace. So if every visit you present, they notice that the band on number 3 on your right shoulder is looser, then they will have to tighten it up. And for those of you watching, it is not about tightening up the bands everywhere, because we do get patients like that who said that, look, my band number 4 and number 2 is too loose, I'm going to cut it myself. Lord forbid, don't do that, okay? Because you do not get your scissors and start cutting it yourself, okay? Because you can actually throw that whole spine out of balance. So when your practitioners are bracing you, they've been trained which pressure has to be applied, what sort of movement, which pressure do you try and avoid. So it is actually not about how tight you make the brace. So in that case there, being present with the practitioner physically is quite important. But if, let's say, you're having one of those days where you notice that the band is too loose, and your doctor is okay with doing a video conference, then you can show them the brace and say, look, my brace is a little bit too loose on this side, number 3. So all of the elastic bands will have a Velcro that shows the number. And then you can say, look, my number 3 is a bit too loose. What should I do? And then the practitioner will probably ask you, can you show me what your back looks like? And then they're able to visually look at your spine, look at the way you are braced, and give you a very good idea that, look, that number 3, can you pull it a bit tighter first? Okay, but ideally, it's best to see someone near you and get them to modify the brace accordingly. Okay, Mr. Ruby? Yeah.
Yep. I thank you. I know, actually, we are scheduled for this
Yes.
coming Monday. So hopefully there are positive findings. Thank you. Thank you very much.
Yep. Yep. No problem. All the best. Yes. Okay. I do see something here from Lloyd Ryan Flores. An orthopedic doctor advised a 45-year-old male with pain, scoliosis of 30 degrees, that surgery is not needed due to their age, no braces worn. What are the alternative management case? That is actually good advice from the doctor, because usually, you see, this is one of the things that we always talk about, is that when you see your doctor, for example, in the case of the 45-year-old male, okay, so if you're 45 years old, your curve is 30 degrees, that is not really in a surgical range. So that was a good judgment call from the orthopedic surgeon to say, look, you don't need any surgery for that. In terms of bracing, you can wear the spine cord brace for this particular case, because the spine cord brace for adults was specifically designed for pain management. So whenever we treat patients with bracing, especially adults, it is not about trying to reduce the curve in adults. For adults, it's all about pain management, stabilizing the spine, reducing the pain, slow down the progression. But whereas for children, it's completely different. For young kids, the main objective is to either try and correct, to reduce the curve, slow it down, provide stability. Okay, so in that case there, Ms. Flores, you can actually give a call to ScolioCare, ask them if they have someone near you, because at 30 years old, you also have to look at if someone is having pain, or in this case, it's painless. So if someone is 30 degrees, they don't have any pain, and they're concerned more about the cosmesis of it, what it looks like, then yes, they can wear a brace. But for some patients where there's no pain, there's no symptoms, or there's nothing debilitating, it's not changing their bowel bladder function, then the question is, do you need treatment for that? Yeah? We have a question from Rinalyn Damol. And the question is scoliosis fatal, and what degrees make it fatal? Are exercises and proper posture enough to stop it from getting worse? Scoliosis, in some cases, yes, it can be fatal. And it really depends on how large the magnitude of the curve is. So one of the things when we look at scoliosis is that the degree, surprisingly, varies from every patient and how they deal with it. For example, we have patients who are 120 degrees, or we had a elderly lady who was 140. She's already had 6 children, absolutely no symptoms whatsoever, no back pain. She's had 6 children, and all of it was natural birth, not even a cesarean. And she does not experience any breathing problems or any kind of symptoms at all. But then we also have patients who are 30 or 40 degrees and they're already experiencing bowel bladder issues or they're having breathing problems. So the angle of the curve does not always, it's not indicative of how bad or severe your body is coping. So you can have someone with a very large curve and they're coping quite well. But once again, you do have to have a proper assessment, which is why if your curve goes beyond 40 degrees and you do present to an orthopedic surgeon, they will usually recommend that you should have a thorough assessment to have a respiratory test to check, your lung capacity, to have a ECG, check your heart, and do all the other tests to see whether or not you're coping. For some patients, they do need to have surgery. For some patients, if it's, it comes down to the surgeon as well. For example, we've actually had cases where the patient's curve was 90 degrees, and we referred the patient off to an orthopedic surgeon, and the surgeon said, "Look, I'm not touching it. There's no point having surgery for your age, so just learn to live with it." And we've had cases where a young child presented, and she was only 10 years old, and her spine was already almost 40, and the surgeon said, "Look, we shouldn't be waiting for this. Let's do it immediately." So really, you need to have a proper assessment for that. Yeah? Okay. We have a question from Shane. You wore a Milwaukee brace back in 2009. You were 12 years old back then. You only wore the brace for 1 year because it was expensive. Okay. And you're quite worried on your follow-up of scoliosis because you're now having back pain. Shane, where are you at the moment? Are you in Philippines or Malaysia? Because in terms of where you are, there's quite a lot of patients who, once again, the spine core practitioners worldwide. It's in over 70 countries, and we do train the doctors in Philippines, Malaysia, and Indonesia. So in terms of bracing, if let's say any of you are wearing a hard brace at the moment, and you decide that, look, I'm going to come off the hard brace and immediately have a transition into a dynamic brace, we will usually discourage you from doing that. And the reason being is that if you've been wearing a rigid brace for more than 6 months and you've been consistent and compliant and you've been doing it on a regular basis, your body has already learned and become accustomed to that rigid brace. Your muscle tone has become, kind of loosened up, weakened. So if you suddenly remove the hard brace and you suddenly go into a soft brace, the outcome is usually not that good because you don't have much of that muscle stimulus. Now, if on the other hand, a patient has been using a rigid brace and they have not, and they've removed it, they haven't worn it for many, many months, and you decide that, look, I want to go into the spine core brace, then we do recommend that if that's the case, do some rehabilitation exercises first. Now, quite a lot of the spine core doctors, practitioners throughout Philippines, Indonesia, and Malaysia, they have learned how to do the corrective movement exercises. So they can teach you the exercises to build up your muscle strength, your stability. So by the time you're ready to wear the dynamic brace, you've already developed that posture, that the strength in the spine, so you can do that transition. But if you are going to change from a hard brace to a soft brace immediately, then you need to have an assessment first to see whether or not your muscles are capable of adapting. Okay. We have Miss Lastel Torio. You have a 4-year-old son who's been diagnosed with liver scoliosis last year. The doctor said the curve is around 10 degrees and said to observe and did not recommend any intervention. Can we do something? Absolutely. If you have a 4-year-old child that's 10 degrees, yes, at that age, you probably don't need to do bracing yet. But our recommendation is always that your x-ray was more than 1 year ago. Usually for children around 3-4 years old, they're still learning how to walk properly. And they usually have very bad posture anyway. Okay, the way they walk, they're still waddling around. And in Asia, a lot of parents love to carry their children. Okay, and unfortunately, the more you carry that child, they're going to become very lazy. Okay, and in Asia, we see that quite a lot, especially if you have a nanny or someone that looks after your child. Okay, so put the child down, let them walk. They may scream and yell, okay, but they need to walk. Okay, and it's through doing that that they learn how to balance. But if you're going to be holding and carrying the child until they're 4 or 5 years old, and we actually see patients who still carry the child even up to 5, 6 years old. And at that age there, you don't do that. Okay, and also another thing is when they're quite young and they're walking all over the ground, they're slowly building up muscle tone in their feet. So if they're running around on the grass with no shoes on, it actually builds up the arches in the foot. So whereas if they're constantly being carried, then you're looking at things like flat feet or poor muscle tone in the legs. So in terms of that 4-year-old child, if you're worried and you notice that the curve or the way they stand looks quite distorted or the posture is getting worse, and very similar to that picture that I was showing how to assess the posture, keep an eye on that. Look at the shoulder blade. Is it sticking out? Is it protruding? Are the shoulders level? Look at the collarbone, the eyes. Look at the hips. Look at the legs. So, and this is something that you can go to any of the practitioners and get them to do a proper assessment. Now, if let's say that child, the curve starts to go beyond 15 degrees and you do have a family history of scoliosis and you notice that the curve is increasing, then under those circumstances, then yes, early intervention is warranted. Okay, we do have a child that's 4 years old, a patient that was braced, and the whole family did have scoliosis. So that was one of the things that we braced the child because of that. Now, from Binga Suseno, you asked about what is a good diet or vitamin for people with scoliosis that can help you. Shall we take calcium? Now, that's a very interesting question. There was a book written by someone in Singapore who claimed that scoliosis was a condition due to supplementation problems. That is absolute rubbish and nonsense, right? Unless you're telling me that you have really severe calcium deficiency, vitamin deficiency, or you're having osteoporosis or something like that. And if you read that book, it even claims that people who eat lots of chocolate get scoliosis. And I can tell you, I love my chocolate. I don't have scoliosis. So that is absolute rubbish again. Okay, so, but once again, what is a good diet? Well, when it comes to scoliosis, you probably hear people say, look, you have scoliosis, take lots of calcium. It makes your spine stronger. It makes your bone stronger. And just because it makes your bone stronger doesn't mean it will straighten out your spine. So a lot of people get this idea that, look, take calcium, make your spine stronger. And the impression is the word stronger means your body suddenly becomes like Superman. You become stronger, your muscles start to activate and it straightens out your spine. It doesn't. So what it does is that calcium is very good. You do need it anyway, especially for growing children, especially for young girls. Because one day when you have children, you have babies, that baby is going to get all its calcium from you. Okay, that baby will be a parasite for the rest of your life. Okay, the moment you're pregnant, it will suck all the calcium, as much of it, out of your spine. So your spine actually becomes pretty much like a bank of calcium. And as the baby grows, it starts to make withdrawals out of your bank account. Okay, and they probably will continue doing that when they're older as well. So in this case here, you need to build up that calcium store in your spine anyway. So the calcium is good for your spine. And also another thing is this: if you have scoliosis, the weight distribution in your spine is not symmetrical. So if, let's say, I'm leaning more to my left side, the side that experiences the most impact is usually the side that gets more calcium deposits. So this is one of the reasons why when you're looking at adults who have osteoporosis and they have scoliosis, you tend to find that one side of the spine tends to be more what we call osteopenic, which means that it's becoming more calcium deficient. And in the past, they used to believe that, look, if an elderly person has scoliosis, really there's not much you can do about it. And there's been a lot of studies where they show that if an adult or an elderly person undergoes some form of loading exercises, where they might do some very mild, gentle weightlifting or resistance exercises, it actually does restore back the density of the bone. Whereas previously they used to believe that once you go past puberty, your bone no longer starts to grow or restore back its calcium stores. So that was actually quite interesting. So in terms of diet and etc., there's no magic diet for scoliosis. Probably a nice healthy diet, dark green vegetables, all of that is very essential. Now, we have John Paul Sipe. Is spine core applicable also for 2-3 curves? Absolutely. Spine core was actually designed for the 39 different types of curves. And in terms of spine core, it does have very specific bracing techniques for single curves, double curves, triple curves. And when we talk about single curve, it's single curve either in the upper body or lower back. And if, let's say, you have a double curve and your primary curve is in the upper body, there's specific type of bracing for that. Or if you have a double curve and the primary curve is in the lower back, then there's specific curves for that as well. If you have triple curves, absolutely. Now, in terms of the cost, as we are the distributor for Philippines, Malaysia, Indonesia, whenever we make purchases, we buy in bulk. And we're able to keep the price lower than other countries. Spine core, unfortunately, is not cheap. Okay, but it is far more cost effective than rigid bracing. So if you look at rigid braces, it may sound that it is probably cheaper. For example, like in Indonesia, they charge 15 million, which is about $1,500 for that. And spine core brace comes across almost like $3,000. And a lot of people actually think, my goodness, $3,000. And rigid brace is only, let's say, $1,000. It's cheaper. But one thing about rigid braces is that during that 2-year period, you will need to have at least 3 to 5 rigid braces made, which means that by the time you have made that brace in that 2-year period, that brace would have cost you at least $5,000, whereas the spine core brace during that whole 2 years only cost you $3,000. And the other thing as well is that depending on the practitioner, some practitioners actually do have installment plans and all that. So different kind of, but if you compare the prices of Malaysia, Indonesia, and Philippines, where we are the distributor, we are far more cost effective than Singapore, or even in the Middle East, or even America or UK itself. And one of the ways we do that as Scolio Care is that we buy everything in bulk and we push the savings and to all of you actually. So we have patients who fly all the way from the Middle East to Indonesia just to get braced. And one of the things they do comment on is that by the time they fly all the way down to Indonesia, they stay in the hotels for 3 to 5 days. They eat, they do shopping, the transportation, get the bracing done, and they fly all the way back to the Middle East. It is cheaper than them going to Qatar or Jeddah to get braced. So our cost is actually far cheaper. In Singapore, they charge about 4,500 to 5,000, whereas we charge 3,000. So unfortunately, the prices of spine core is fixed by Spine Core UK. And if you're in America, they charge 7,000 to 9,000. So in terms of pricing, yes, we try to keep it as affordable as possible. Now, for Shane, you have another question. Is there a right age to stop bracing? One thing about bracing is that it's pretty much like, for example, if you have high blood pressure. As long as you have high blood pressure, you continue to either take medication or watch your diet, continue exercising. One thing with the brace is as you continue growing and your spine is changing, you need to wear that brace. To wear the brace, you need to wear that for a minimum of at least 18 to 24 months. So if, let's say, you started bracing at 12 years old and you're now 14, you've done your 2 years. But from 14 to 16 years old, you are still growing quite aggressively. You're growing quite rapidly. So I would not stop that brace at 14 years old unless your spine has completely improved. So under those circumstances, if you need to wear it over a longer period of time, I would absolutely encourage you to do so. Now, Erazel Alviz. Hi, how are you? you have cervical lordosis, thoracolumbar dextroscoliosis. Now, in terms of your neck is supposed to be a C curve, and it's approximately 42.2 degrees curve. So if I'm looking at you from the side view, your curve is supposed to be 42.2 degrees. Over time, it starts to straighten up, and then it reverses. Now, having a lordosis in the neck, that is normal, okay? So you do have, lordosis basically is the curve that you have in the lower back, which is a C curve, and then your upper body is called kyphosis, which is a reverse C curve, and then your neck is a lordosis. So your spine actually looks like an S curve. So, but in terms of how much lordosis you have in the neck, especially with young people nowadays, or people nowadays using the mobile phone devices a lot, you're constantly stooping your head down this way using a mobile phone. So your curve goes from a normal 42.2, straightens up, and then starts reversing. That's when you have kyphosis. And so having lordosis in the neck is good, no issue there. If you have a curve that is 24 degrees, you often have migraine and etc. Is it due to scoliosis? There's over 200 different causes of headaches. So you can have headaches that are quite compressive, expensive, or it is throbbing. So there's many causes. It can be anything ranging from your eyes to your ears, your bite, your jaw, the way you bite, and etc. You may have jaw problems here called TMJ dysfunction. So all of this can contribute to things like headache. Scoliosis, yes, it can cause it, but it does not mean that your scoliosis causes your headache. But if, let's say, you've already ruled out eye problems, jaw problems, or you have any other underlying pathologies, you have that all ruled out, and the only thing is a scoliosis, then yes, it's possible. But scoliosis itself does not cause headaches, and all headaches are not due to scoliosis. Okay? And what is the best home remedy? Well, you first of all have to find out what's causing your headache. Okay, now the other thing is you also have numbness in your arms and your legs. So that is something that you need to go and have a look at. If you have tingling numbness down your neck and shoulders, the nerves in your neck controls everything down your arms into your fingers, and everything in your lower back controls everything from your bowel bladder all the way down to your legs. So if you're experiencing any of this numbness or paresthesia, loss of bowel bladder control, then you do need to go and get it checked. For Miss Winnie de Chavez. Okay, your daughter goes to POC for her adjustment. Is there a place nearby Binyan Laguna for her brace? Absolutely. If you're in Binyan Laguna, we can arrange one of the doctors to see you there. Usually on a regular basis, we do have Dr. Hector, Dr. Chung, they do travel. And so once again, in terms of quite a number of doctors are willing to travel. And some of them actually do, we try and arrange different venues for them to see patients. And, we're very grateful. If any of you know the spine cord doctors in Philippines, they're very, very dedicated. Some of them will travel distances just to see the patient, to help them. So, you're quite lucky. In Philippines, the doctors there are very, very, they're very committed, to spine cord. It was actually quite interesting when we first went to Philippines to teach spine cord, and I was actually quite amazed how many doctors there actually knew about spine cord. For example, like in Cebu, you have Dr. Flordelis. We sat down during a buffet, and she told me literally almost everything about scoliosis, and I was blown away that she knew so much about it. So, you have a lot of good doctors in Philippines. So, rest assured you're in good hands. Now, for Miss Cherry B, do you know any doctor in the United States that uses spine cord for the patients? Absolutely. Spine cord is huge in America, and literally in almost every state, you've got at least 5 to 10, in some cases, even up to 20 spine cord practitioners all throughout America. If you go into the spine cord website and you type in your zip code, in America, you guys call it zip code, or if you're overseas, we call it postcode, and you type it in, they will give you the name of the closest practitioner to you. So if you are already seeing someone in Philippines and you decide to see someone in the West Coast in the US, you can actually see a spine cord doctor in America and ask your practitioner in Philippines to transfer your files over to them. So they can do this cross contact. From Alma Garcia, how are you? So you say that any contact or email that you can contact, absolutely. I do have my Instagram, and you can always get it from Scolio or Miss Amanda, and more than happy to answer every question. For every message that I get on Instagram, Facebook, everything, I do personally uh, reply. I'm a workaholic. I like answering questions. I don't sleep much, so rest assured that if I don't reply you within 1 or 2 days, but I usually will definitely get back to you. Okay. Now, JP Sepe, once again, thank you very much as well for joining us. Most of the patients have financial inadequate. Okay. In terms of what is the cheaper option for spinal orthosis, it is not about the cost, unfortunately, because you can go to, let's say, a pharmacy and buy a posture brace. It is not going to address your scoliosis. You have many different types of scoliosis there, and you need to address it quite specifically. Okay, so it is not about the cost or so. And depending on where you are, quite a number of the practitioners do arrange or have some sort of a payment option available. Okay, Miss Angel, you had 86-degree curve before you underwent spinal fusion. It's now down to 65. Ooh, that's very good surgery. So will wearing spinal cord brace potentially? Unfortunately, no. Once you've had surgery, we can't really use the spinal cord brace. But if, let's say, you've had the surgery and you've had the brace, the surgical fusion removed, so any of the surgical hardware removed already, and it's been more than, let's say, a year or so, and there is no any kind of contraindication, then when the brace is not going to change the spine, because once you've had surgery, there's adhesions, scar tissues formed, and it makes it very difficult for to make any kind of correction there. But if, let's say, you're experiencing some sort of a back pain or some instability, then the brace may be used for support or pain management, but it is not going to reduce the curve. Because once you've had surgery, then unfortunately it won't. Yeah. Now, Ryan James Miklat. Okay, how are you? Is there a study that chiropractors may reduce scoliosis curve progression? This is actually very interesting. Chiropractic actually has a very long history with scoliosis, and especially spinal misalignment. And the basis behind that is when a chiropractor looks at your X-ray, it is virtually like a GPS system for a chiropractor. When chiropractors look at X-rays, they are able to analyze and look at many different things. So it's literally almost like opening up a menu book for chiros. So they will look at your X-rays and they're able to look at where is the misalignment, where is the rotation, where is the primary, which is the secondary, and they're able to look at that X-ray. They're then able to give what we call a specific listing. So you can actually have a look at a spine and it's tilted, let's say, to the right side, and it's rotated and it's shifted. They can have almost like a coordinate system, almost like a GPS coordinates on how to label that bone. So if, let's say, you went from one chiropractor to another chiropractor and they use the constant system, they're able to use that specific listing to advise the other chiropractor where they saw the X-ray and what they saw on the X-ray and how to address it. In terms of reducing scoliosis and etc., chiropractic is very effective, extremely effective in reducing pain. It is also effective in opening up restrictions and adhesions and etc. But once again, if someone has scoliosis due to pain, for example, if I had a pinched nerve and I'm leaning to one side because I'm in a lot of pain, and then I have chiropractic treatment in that, and you've removed that impingement and the spine straightens up because now they don't feel the pain, they don't have what we call withdrawal reflex. So now I'm standing straighter. So yes, in that case there, you're looking at what we call antalgic posture. So your posture changed because you're no longer in pain. But if someone is dealing with idiopathic scoliosis, that is a complete different ball game. So if I'm having scoliosis because the shape of the bone has changed, or the structure has been modified, or the way the nerves are behaving has completely changed, then chiropractic in itself is not going to change that structure like that. Okay, and this is something that we have to be very realistic. And it's not just chiropractic. even with things like osteopathy or with physiotherapy. If someone has scoliosis and they're going through some sort of a growth spurt, no amount of exercising, you can exercise 24 hours a day. You can do stretches, and you can do that as much as you want. It is not going to change that. Your body, if it decides to grow, it is going to grow. It's like a tree. You can put a whole concrete slab on top of a tree. If it wants to grow, you'll push it over, okay? So, but if you're experiencing pain, discomfort, restriction, yes, absolutely. And as a matter of fact, in America, most of the spine core practitioners are chiropractors, and they're able to incorporate the chiropractic treatment and the spine core bracing as well. So they're able to reduce the restriction. Yep. Now, can we ask for the recording? That you'll have to ask Amanda and Miss Rizzi. Miss Sekar April, apa kabar? Ya, baik ya, selamat siang. Ya. You're from Jakarta. I'm also in Jakarta as well. So absolute pleasure meeting you. So the question is it good practice for yoga Pilates with no bone problems? Oh, hi, Ibu. How are you? Yeah, I see you there.
Hi.
Yes. Yeah. How are you? Yeah. Apa kabar? Yeah. Okay. Is it true that your friend said that most people don't have 100% perfect spine? Yes, absolutely. It is true. It is virtually almost impossible to see anyone who has a perfect structure. For example, look at your face in itself. You may have one side of the jaw that's a little bit more nicely contoured, the other side sticking out. Your rib cage, is not going to be perfectly C-shaped. But in terms of perfect spine, yes, we do see people who have curves below 10 degrees. So if you consider a perfect spine, then anything normal, then it'll be anything less than 10 degrees. So if someone has scoliosis with nothing debilitating, so even if, let's say, someone has scoliosis, Pilates and yoga is not an issue. But if, let's say, they do have other problems such as Lateralized Thesis or let's say, Orthosis or de novo, then that can be a little bit of an issue there. But if the spine is perfectly normal, they're doing it for general health purposes, absolutely, no issue there at all. Yeah. Okay. And let's see. Vivo 1801. You have a daughter that's 9 years old, has been diagnosed with 50 degrees juvenile dextroscoliosis. You went for an MRI lab. The doctor said there's an intramedullary spine cyst. MRI said that can be cause for that, and we do check up. Okay, yes. What the doctors have recommended there is absolutely, I would agree with that. If you have any kind of pathology in your nervous system, for example, you have a cyst inside the spinal cord area, then your orthopedic surgeon, this is actually where there's a bit of that demarcation there. The orthopedic surgeon would tend to deal more with the structures of the bone, surrounding tissue. The neurologist will deal, or the neurosurgeon will deal with anything to do with the nerves. So if the cyst is in the nerve, then that goes into the domain of the neurosurgeon. If the cyst is in the bone, then that is more the orthopedic surgeon. So yes, so in this case, is it the one that's causing the scoliosis? It's hard to say. So it is one of those things that, did your child have scoliosis before the cyst, or did they start developing the scoliosis after they have a cyst? And that is something that nobody's ever going to be able to address it. But having a cyst in that spinal cord area needs to be addressed. So yes, I would absolutely recommend and agree with the doctor that you do have to go and see the neurologist to have that spine addressed. Okay. Now, okay. So Miss Renalyn, once again, thank you very much. I thank you as well. So Walang Anuman. Yeah. Oh, I've got lots of questions. Yeah. That's my wife there. She's chasing me. She said, you're going over time. Okay. So Miss Christine Joy Sabion, you've been diagnosed with just a mild scoliosis in the lumbar area, in the low back, in the left side of the hip. Always hurts for 7 years now. You've been through 3 doctors. This you should exercise. This has been for 7 years. In terms of lower back, if you're having a hip problem, let's say your scoliosis is quite mild, it is not causing any issue. In the back of your pelvis, you have what we call the sacrum, and your bone on the side is called the ilium. There's a joint there known as the sacroiliac joint. And there's been studies where they found that if a person has asymmetry in terms of the flexibility of the joint, or if, let's say, one of the joints on the right side, let's say the joint on the right side is restricted, and the joint on the left side is moving more, that will actually cause pain. If you've been doing exercise and etc., that will help strengthen the joints, strengthen the muscles. But if you're still experiencing pain, I would go and get that checked and find out why. Because if you have laxity or looseness of that ligament in that pelvic area, it can cause pain. Or if you have problems, there's a muscle in the front near the groin area known as the psoas muscle. That can also cause problems as well. But if you've been experiencing low back pain, it's been there for quite some time, you probably need to do other type of things as well. Get an ultrasound, get checked, make sure that there's no ovarian cyst or some other pathologies as well. So do get it checked, yeah? Dr. Shane, you're from Philippines, you used to go to Philippine Orthopedic Center when you were 12 to 15 years, okay? So percent here follow-up, okay. I would recommend, in your case, do go back and see a doctor to see whether or not you still need to get bracing, okay? Now, Charis M, hello, how are you? You have a double curve in 2018, 17 degrees, and the bottom was 13. Your latest x-ray shows that it became mild, and 20 degrees, so I need to wear the brace. Okay, you're 30 years old, you're having your PT session in Philippines. Okay, so once again, in terms of that curve, it's quite mild in that sense. For most patients, if you have scoliosis and experiencing pain, spinal cord brace is an option. So if you find that, yes, you do have scoliosis and it's causing pain, and you do want some pain relief, you've done physiotherapy, you've had some sort of treatment, you've had everything, and nothing seems to be helping, then you do need some sort of a support. And yes, you can wear the brace. But so once again, it's not compulsory, but in your case, if you are considering it, it is actually quite effective for low back pain as well. Okay. Now, CJ Darit. Okay, what causes the bone deformity that causes scoliosis? Interesting. Will the curve increase later in older life? Absolutely. So the bone deformity in this case here, as we mentioned earlier, is a genetic issue. So in this case here, we're dealing with different parts of the bone, how it grows. Sometimes one side of the bone may grow faster than the other, or in some cases, there may be halting or a retardation of that bone. So because of the way the bones are growing, for example, when we're dealing with genetics, the different parts of your body grows at different rate. So if one side of the bone is growing faster than the other, then it will start to cause tilting. And the tilt itself will apply pressure on one side of the spine. And that in itself can end up slowing down the spine from growing, and over time causes scoliosis. And will it get worse? Well, as time goes by with any kind of spinal condition, we usually call it ASA 1, 2, 3 and de novo, which means, let's say you had scoliosis as a child, and during your teenage years, the scoliosis somehow halted, and then you're now an adult. That scoliosis can either continue to become more progressive, or it may magically just stop and it doesn't grow anymore. Or in some cases, it may even accelerate. So depending on what type of scoliosis you have as an adult, then there's different ways of addressing it. Now, there are a lot of patients who have never once in their life have scoliosis. And all throughout the younger years, the youth, they've had absolutely no spinal condition whatsoever. Then they hit menopause, and suddenly they start experiencing back pain. They go for an x-ray and they realize they have a really horrendous looking spine. And suddenly there's scoliosis. Now that scoliosis can appear out of nowhere, and that is known as de novo degenerative scoliosis. And in those cases, you can actually have the spine completely unstable and shifting off to the side or forward. So those type of scoliosis, yes, your curve can increase over time as well, because if you are being tilted to one side and that pressure on the bone does cause the bone to change shape, it's called remodeling or osseous remodeling or bony remodeling. So the bone does change shape over time because of the pressure that you're applying on it. Imagine you're stepping on it's like your shoes. If you put pressure on the outside of your shoes every day, over time the outside of your heel will start to narrow, it flattens. So yes, it does happen in the spine. And in cases of patients who do get pregnant. Now, there's been a lot of studies saying that, look, pregnancy does not increase scoliosis. And yet, there are also conflicting studies saying that, yes, pregnancy can increase scoliosis. But one thing we do know is that when you do get pregnant, your body produces a hormone known as relaxin. it loosens up literally all of the ligamentous structure in your spine. Because if you look at the pelvis, the opening is really small. Your baby's head is about the size of a football, and the body is trying to push through a very small hole. So you do have this hormone called relaxin, which tries to loosen up all your joints to open up the pelvis. And the idea is that it allows the baby to slide out, okay, assuming that there's no breech birth and etc. So in this case here, because this hormone doesn't just affect the pelvis, it affects the whole spine. So if your spine is already tilted, the ligaments on one side is already overstretched. And if that ligament starts to become looser, more laxity there, then yes, in some cases, the scoliosis can get worse throughout pregnancy. Although that being said, we've actually seen patients who, after pregnancy, magically the spine actually improved. So it's one of those where, yes, it does, and sometimes it doesn't. Okay. Now, we also have Josette Jonafé Dayamak Oteza. Does Spinal offer training to rehab specialists? Absolutely. How do you apply? You can contact us. You can send me an Instagram message, or you can contact Scolio Care Corporation or ask Miss Amanda, and then she'll get you in touch with me. We do train rehabilitation specialists, pediatricians, orthopedic surgeons, depending on the country. And different countries, we also train chiropractors, osteopaths, physiotherapists, or even in cases such as even orthotists. So as long as you're a practitioner and it's within the realms of your practice that you're allowed to do that, then absolutely, we are more than happy to train, and the more the merrier. Yeah. Now, Miss Elaine Kuyamko, you just recently found out that you have 19 degrees corpse angle, 2 degrees muscle spasm. Your L5 is already sacralized. I haven't consulted. Okay. You've been going to the gym for 3 months. The question is there any possibility of preventing it from further progression? Well, at 19 degrees, it is still considered mild to moderate. The exercises, you have to be very careful. Before you do any kind of gym exercise, I would absolutely say consult a practitioner first. Okay, and the spinal doctors in Philippines have been trained on what type of exercises to recommend and what to avoid. So you can actually see them, Philippine Orthopedic Center, or in St. Luke's, or if you're in Cebu, you have Our Lady of Perpetual, Cebu Rehab, you have Rojas and Mindanao. They're all over the place. Okay, so you can see one of the practitioners. They all have learned corrective movement exercises, and they can tell you. So if you're in the gym, they can tell you what exercises you should avoid and what you can. Okay, for Miss Emily as Torrevillas Lagao, how are you? I like all the Filipino names. They're very strong Spanish names. Yeah, you know, when I was in Philippines, I used to say, I wish one day I'll encounter someone called Antonio Bandaras. You know, such a strong name there. And your question is, you've been operated 7 years ago. Orthopedic surgeons say it's totally fine to not remove the implant. Is it safe? The implant, we've had a lot of patients where they do have scoliosis and they've have the implant and they've had it for decades. So your orthopedic surgeon will know whether or not it is safe to keep it there or to remove. In all the years of practice, I've only encountered only one patient who's ever had the implant removed, and that was only after an infection. But for all the other patients I've seen who've had implants, they've had children, absolutely natural birth or cesarean, and having the surgery, it does not exactly restrict you from literally everything. I've seen, for example, you have doctors who've had scoliosis and they've even had surgery and they're very active. And one of the doctors that we know of actually had scoliosis, has scoliosis surgery, and she's very, very active and she exercises quite a lot, so no issue there. Okay, do you recommend chiropractic approach to scoliosis patients? Well, once again, it really depends on what is the treatment for. So if you're using it for pain management or reduce restrictions, absolutely. If you're using it purely as the only treatment for scoliosis, then I'd say that the chiropractic will address a certain component of it. but you do need a more directed approach for scoliosis. Okay. Now, Alvin, Umali, how are you? So you're 26 years old. You were able to do everything like work, etc., physical doctors, orthopedic session, then now it's hard for you to sit at least 30 minutes. Okay, so in terms of scoliosis, if it's causing you any kind of restriction, once again, it's very hard to say whether or not it is the cause of your scoliosis. So I would say, of your pain. So I'd say get it checked because it could be anything. It could be a muscular issues. But once again, if you start to feel any symptoms of tingling, numbness, loss of bowel bladder control, or breathing difficulties, I would say go and see a doctor and have it addressed. Okay. Good question, Israel Lazan. You ask about sleeping position. Okay, when it comes to sleeping position, it's one of those questions where people say that, look, should I be sleeping on my back or on my stomach? And the question is, well, it really doesn't matter because ideally you should be lying on your back. And you have a lot of patients who said, look, I tried, and your body is designed that when you're sleeping, you will twist and turn. Okay, so you will roll to the left, to the right, and it does that to allow blood circulation into the muscles that has been compressed. So if I'm sleeping on my right-hand side, I will over time cause restriction of blood in that area. So your body will naturally flip you over to the other side. So you may end up going to bed lying face down, okay, and you wake up facing upwards, and etc. So ideally, it should be facing up, but once again, but of course, if you lie face down as your only way of sleeping, that's not a good idea because you'll end up twisting your neck, tilting to one side. Lying on your side should be okay as well. Yes, so once again, sleeping position, there's no real so-called ideal method, okay? We have Francie. Oh, hi, Francie, how are you? Haven't chit-chat with you for quite some time. Please give regards to your family. So are yoga exercises and anything okay? Yoga exercises depending. There are certain exercises like salute to the sun or the cobra or the one that makes you look like a sphinx. That one there, if you do have Lateralized Thesis, I would avoid that because it can exacerbate it. Okay? So here we go. Now, Miss Winnie D. Chavez. Wonderful. Thank you. It has been a pleasure. Okay. Is there anyone I haven't met? Oh, yes, Vela Velasquez. So you have a daughter that has an S curve, 47 degrees, and one butterfly hemivertebra. Interesting. So when it comes to scoliosis, you do have what we call congenital scoliosis. So this is where you're born, where the shape of a bone is not rectangular or square in that sense. And sometimes you can have a bone that is completely compressed in the middle or to one side. And for those type of cases, the spine core will not change it. It may improve or give some sort of stability support. But once again, if at 47 degrees, this is where you start looking at more orthopedics. And sometimes the orthopedic surgeon may do some bone impaction there, build up that bone to make it more rectangular. But once again, this is something that you need to talk to a spinal surgeon. And you're thinking of spine core. Once again, for that one there, we do need to do an assessment. Usually for any cases where it's congenital, we usually discourage the spine core practitioner from bracing, okay, because it is considered a contraindication. However, if it is justified and it is not a severe deformity, then we may consider that. So usually for any of those kind of cases, every practitioner will have to show us what the x-rays look like, what the photos look like. Then Spine Core UK and myself will have a discussion. And only when we feel comfortable that this condition can be managed, then we do say yes. Otherwise, we will usually say no, okay? Now, Ms. Sheila, you have mild scoliosis. It's increasing. You're thinking of having surgery. Okay. Once again, once you've had surgery, unfortunately, you can't wear the spine cord brace, okay? Okay.